We're going to talk about a group of muscles that pretty much all of us think we know, but honestly, very few of us truly get. The glutes. We're going way beyond the basics to see how this region isn't just about power for things like sprinting or jumping. It's actually the critical anchor for something as simple as walking. So let's kick things off by solving a really common clinical mystery. What happens when this powerhouse fails, and how can it make a simple walk go completely haywire?
You've probably seen this before, right? Someone walking with this really noticeable hip drop. It's sometimes called a waddle, and it just looks unsteady, inefficient, maybe even painful. Well, this isn't just some random quirk. It is a massive clinical clue that points to a failure deep inside the body's core support system.
And that right there is our first big question. How can walking, the most basic thing we do, become so shaky? Well, it turns out the answer isn't really in the legs, but in the muscles that are supposed to be controlling the pelvis.
Yeah, this very specific walking pattern has a name. It's called the Trendelenburg sign. And for any clinician, seeing this sign is like finding a giant flashing neon arrow pointing directly at a very specific muscular weakness. Okay, so this slide breaks it down perfectly. On the left, with a normal walk, the muscles on your standing hip, the left one here, they contract to keep your whole pelvis nice and level. It's a perfect balancing act. But now, look at the right. With a positive Trendelenburg sign, those muscles are weak. The second the other foot lifts off the ground, the whole support system just fails, and the pelvis on that side just drops. Can you imagine the kind of strain that puts on your back and your joints with every single step you take?
All right, so if the problem is a weak support system, who are the heroes that are supposed to be doing all the supporting? Let's meet the muscles responsible for keeping everything in balance.
And here it is. This is our main culprit, the gluteus medius, and its partner right underneath it, the gluteus minimus. Now, these are not the big, powerful gluteus maximus muscle. Nope. They're located higher up, more on the side of your hip. In fact, if you put your hand on your hip bone right now, you're pretty much right over them. These are the muscles that solve our mystery of the unsteady gait.
So here's the deal with their job. Think of them as constantly performing a balancing act. Walking is really just a series of single-leg stances, one after the other. And every single time you take a step, the gluteus medius on your standing leg has to fire up like crazy to keep your entire pelvis from collapsing on the other side. Without that constant, silent work, we'd all be walking around with that unstable hip drop.
Okay, let's pivot. We're moving from stability to a totally different kind of problem. We're going to go deeper into the gluteal region to investigate a super common complaint, a deep, nagging pain in the buttock that gets misdiagnosed as a spinal issue all the time.
You hear this all the time in the clinic. The patient feels that radiating pain, and their mind, and let's be honest, often their doctor's mind too, goes straight to the spine. Everyone thinks, oh, it's a slipped disc causing sciatica. But what if the problem isn't in the back at all? What if it's a muscle deep inside your glutes?
To solve this mystery, we need to meet a whole new cast of characters, the deep lateral rotators. This is a group of smaller muscles that are hidden way down beneath the big gluteus maximus, and their relationship with a major nerve is absolutely key here.
So this slide is basically our map of that deep region. We're looking at muscles like the piriformis, the gemelli, and a few others. And together, they're known as the deep lateral rotators. Their main gig is to rotate your thigh outwards. But it's their location that makes them so incredibly important, because one of them sits in a very, very tricky spot.
And this is where it all comes together. Just look at the piriformis muscle, and then look at that massive yellow sciatic nerve running right underneath it. Now, in some people, the nerve actually pierces through the muscle. You can just see the potential for disaster here. If that muscle gets tight, or spasms, or gets inflamed, it can directly choke or irritate the largest nerve in your entire body.
This condition has a name. It's called piriformis syndrome, and it is the classic case of mistaken identity. The symptoms, that sharp, shooting pain down the leg, are identical to sciatica from a spinal disc. But the real culprit isn't your back at all. It's this small muscle, deep in your glutes, that's literally squeezing that nerve.
And here are the key signs to look for. You get that sciatica-like pain, and here's a big one. It can be brought on by tightness from just sitting for too long, which, let's face it, is something a lot of us do all day. Clinicians can even test for it by moving the hip in specific ways that stretch that piriformis muscle. And if that reproduces the pain, you've likely found your problem.
So, we've covered the crucial stabilizers and the deep rotators that can cause all sorts of pain. Now, let's zoom out to the muscles most people actually think of when they hear the word glutes, the engine room. We're talking about the gluteus maximus and the hamstrings, the muscles that give us the raw power for things like running, climbing, and lifting.
First up, the hamstrings. This group of 3 muscles runs all the way down the back of your thigh. I mean, think about that explosive push-off when you sprint, or the motion of pulling your heel up towards your butt. That is all hamstrings. They're responsible for extending your thigh backward and bending your knee.
This table has all the details, but here's the key thing you need to know. Notice how they all share one origin point, the ischial tuberosity, or what a lot of athletes just call your sit bone. Because all 3 of these powerful muscles pull from this one single spot, it's under an immense amount of stress, and that's exactly why those high hamstring strains are so common and so painful. The injury happens right at that crucial anchor point.
And of course, none of this works without fuel and instructions. This slide shows the incredible network of arteries and nerves that feed the entire gluteal region. To generate that kind of explosive power, these muscles need a massive supply of blood. And for that precise stability, they need crystal-clear signals from the nerves, like the ones branching off that huge sciatic nerve we saw earlier. It's a really complex and absolutely vital infrastructure.
Okay, let's connect all these dots with one last little clinical puzzle. We've seen that the Trendelenburg sign means the gluteus medius is weak, so if we take it one step further, which specific nerve that controls that muscle must be injured?
And the answer is the superior gluteal nerve. It's the nerve that exclusively powers the gluteus medius and minimus. If there's any damage to it, you get that hip drop. It's a perfect example of the chain of command, right from the nerve to the muscle and finally to the movement itself.
So this brings us to the big takeaway question. We focus so much on training our glutes for power, for how they look, but after seeing all this anatomy, you really have to wonder, is their most important job the one we never even see? That silent, constant work of providing stability, step after step after step? It's definitely something to think about the next time you just walk across a room.